Hi, this is Jonathan Rosenhead, the Jerusalem psychotherapist. In this week's Torah and Psychology post, we're going to discuss the mitzvah of Sfiras Emor, which appears in Pashas Emor. Obviously, it's topical for right now, which we're in the period of counting the Sfiras Emor. And let's discuss a very famous question of how to understand the mitzvah of Sfiras Emor. Based on the Gemara in Menachos and the discussion in the Rishonim, and this is also brought in the Minchas Chinuch, there is a discussion of the mitzvah of Sfiras Emor and how it could be perhaps separated into two distinct mitzvahs, that we count the days and we count the weeks. This is brought in the Gemara in Menachos, and it's unclear, and the Gemara discussed what was the minhag of how people counted. Was there a separate bracha for the days and for another one for the weeks, or whether you count just the days or whether you count just the weeks? There's some discussion, and it's unclear exactly how to understand the mitzvah of Sfiras Emor and the counting of the days and the weeks. Rabbeinu Yerucham takes a rather novel approach in suggesting that in fact there are two separate mitzvahs. We have two distinct mitzvahs of days and weeks, and in fact it should require separate brachas, one on the day, one on counting of the days, and another bracha on counting the weeks. That's how the Rabbeinu Yerucham understands the sugya and understands these dual aspects of days and weeks, whereas the Rambam, he argues and says, although there are two separate, he agrees, the Rambam says there are two separate aspects of days and weeks, but they are not separate mitzvahs. In the Sefer mitzvahs, they are listed as one mitzvah, Sfiras Emor, of days and weeks. And according to the Rambam, although there are two separate aspects, they are in a way integrated and fall under one category, under the general umbrella of the mitzvah of counting of Sfiras Emor. And what we see here from this discussion, based on the Gemara Menachos and the Rishonim, is that perhaps we could say there's some ambiguity about the mitzvah of Sfiras Emor and how to understand the different aspects of Sfiras Emor, because everyone agrees that there are two parts. There is the days and the weeks, but it's unclear of how to understand if they should be viewed as distinct, separate categories in their own right, or whether they are fused and integrated together into one mitzvah. And this can be applied within psychology, psychiatry, physical health as well. In terms of the idea of a diagnosis, of how to come to the point of a clear, accurate diagnosis. And this relates to comorbidity. In comorbidity, whether it's in physical health, psychiatric health, mental health, and in therapy, it's vital that we come to an accurate and appropriate diagnosis to understand what is the person's symptoms, what is the person's struggles and difficulties, as that will lead into an accurate and appropriate treatment. So in psychology, in mental health, there are certain situations, certain mental health problems that often go together, that there is a common comorbidity. We see this with depression and anxiety, or there is mental health problems that go with substance abuse or the use of alcohol and drugs. These symptoms often go together, and it can be confusing because there is maybe a confusion of how to understand the person's symptoms, and sometimes we could say that there is a common core, a common underlying cause that leads to a separation in terms of how a person's problems are expressed. So an underlying cause can be the same, which is then expressed in depression and anxiety. And what we see in this situation, and what is important, is there can be a confusion of whether the practitioner, whether it's the psychiatrist, whether it's a psychologist, whether it's a therapist, how to understand the symptoms, how to understand the problems that the person is presenting. Because there might be an inclination to say, well, it seems to be that you're struggling with anxiety, let's treat the anxiety. And sometimes the depression may be more dominant, and we say, let's try to treat the depression. And there is this balancing act, which can, in a way, be a seesaw of going backwards and forwards, of trying to treat the presenting symptoms, or trying to present maybe what is primary and ignoring what is secondary. But what we understand, and what needs to be stressed, and it comes out more from the Rambam, in terms of the Rambam's understanding of an integrated conceptualization, that there can be two aspects that fall under a single categorization. This helps us in terms of understanding comorbidity, in that the treatment needs to look at it in a look at the person's situation in a holistic way. That whatever treatment is given should not be, in a way, directed towards one symptom over the other, treating one over the other, and moving backwards and forwards. It should be holistic. It should be a treatment, whether it's medical, in terms of psychiatric care of the medication that is given, or the psychological therapeutic approach should try to be incorporate and be able to encapsulate what the person's struggles are, that is able to treat both symptoms at the same time, that they both contribute to each other. The days and the weeks fuse and contribute towards each other. They go together. A person's anxiety and depression or comorbidity, there is an overlap that is important, that should not be looked at in distinction, and therefore the treatment should be holistic. It should be able to be given as an approach that is a general therapeutic approach that tackles both symptoms, both presenting problems, and that will help a person to be able to develop and come through and hopefully find a way to treat both the depression, both the anxiety, that the comorbidity is treated in the right way. Have a good Shabbos and keep well.